So next I want to introduce Shirley Hart. Shirley is a peer-certified navigator and a peer support specialist, and she provided navigation services in the Fayetteville and Rayford area. Shirley is the director of the Tia Hart Community Recovery Program, a leader in the recovery community, and on the board of the Sandhill Mental Health Board. She is well acquainted with gaps in services, support, and education that lead to challenges for people in recovery. Today she's chosen to talk about medication and early recovery. So we all know overprescribing is running rampant in this country. And not only is this a public health issue, but it's especially important to keep in mind for consumers entering recovery. So Shirley's going to cover the ways that medications can impact the recovery process. And she has a tool to share with you for consumers to take control of their recovery. And as providers, you can use this tool to help talk your consumers through how to discuss their medication use with their primary care doctors. So without further ado, Shirley.
Good afternoon, everyone. I too like to thank each and every individual one of you for being here this afternoon. And I am in long-term recovery. My recovery date is October the 15th, 1999. So it's a blessing. Today I'm going to be talking to you about medication and recovery. Okay, it says, why medication are safe to use in recovery? Well, we know medication has a potential to be abusive with some and with others not. But the Class A drugs are opium, oxycontin, Percocets, codeine, heroin, and methadone. And we also should make sure that we read our labels on our medicine. When we receive it from our doctors, we should make sure, or from the pharmacy, make sure that we receive that. Using medication is not a moral issue. We know that it's not a moral issue because once you make the decision to stop using alcohol and other drugs, then it is very important to your health. And when the patients first stop using the medication, using drugs, they can experience a variety of physical and emotional symptoms such as depression, anxiety, restless, sleeplessness, and other moods, disorderly moods. Okay, want to know, why do you need to tell your provider? Why do you think that the consumer needs to tell the providers that they're in recovery? Anybody?
So you get appropriate medications.
Say that again now?
So you get appropriate medications.
Yes. Okay. And also, to help them along with the situation that they're going through and while they're in their recovery. And for instance, if a person is taking blood pressure medicine and they was using while they was taking it and the provider or their doctor provided for them, then now that they're in recovery, their doctor would now have to adjust their doses so that they're, while they're in their recovery. And sometimes the consumers may not be honest with their provider because they had abused medication so much that when they come to you to talk to you about it, they won't be honest with you because they looked at it, like, look, I done stopped, I done went to this doctor, this pharmacy, and got all kinds of prescriptions, and now I got to be honest with myself. So if they're honest with you, then you'll know how to help them in this situation. And that is why with the future relationship with the pharmacy, with the provider and the consumer, you got to be honest with one another so that you can be able to help one another in recovery. Taking medication for anxiety or pains for a long period of time can increase the risk of relapse. And you're taking this medication for so length of time that you get immune to it. And then you'll end up going right back to your drug of choice. So that's why it's not too safe to take a medication at a long period of time. You must deal with your provider. Your provider may want you to try other ways of releasing any pains or anxiety. Maybe put ice or heat on your pain, or massage, or you may take some herb tea or warm milk to relax. Now this here is a medication trial period chart that you have in your package, and these are some of the questions that comes from that trial period chart. And it says, why did I do my non-medication strategy today? So what it means by that, pacing yourself. Did you make the conscious decision to do what is right or what is wrong? Or are you relaxing? Listen to some music, meditate. These are some of the things as far as non-medication strategies. And then it also said, did I take my new medication today? Sometimes we might forget about taking our medication, so we might have to write it down on the calendar. So since we're in technology age, we can use our cell phones and play a certain music that'll pop up and say, oh, this is the music that I need to take today. Or we can use our computer or a notepad, anything, or if you have to have medication with your meal, then put your medication in the kitchen. So you'll know that this is what I got to do. I got to have this medication with my meal. And then it says, how do I take my prescription medication? Well, you want to take it like the doctor prescribed it for you. You want to take it on time, on the day that you're supposed to. Sometimes we might forget to take it that day, but the next day try to get it back and take it on time on that day that you need to take it on. Okay, how often do the symptoms occur today? So this here is a chart. On the chart, you're going to make a notation so when you go to your doctor, you can tell them the different symptoms that you're having. How did it affect you? What occurred while you was taking that medication, so that the doctor or your provider can know how to adjust it for you. And it says, was the symptoms worse, sometimes better, or much better today? On a scale, you can use a scale, say from 1 to 10, it was an 8 today. Maybe this morning it was maybe a 6, this afternoon a 7. So you have some kind of a scale to show to your provider when you go to see them. Okay, medication and recovery. We know that medication may be a part of our recovery process, but in the conventional method of recovery alone is not enough for medication. Recovery may be the missing link. So sometimes we might have to have medication in our recovery. So we don't want to get discouraged because we might have to take it for the rest of our life. Some of us might and some of us might not. So it's not going to be, difficult. But you can say that I can live a drug-free life, a painful life, even though I do have to have this medication, I'm not paining, and it's unmanageable for alcohol and other drugs addiction.
Open the floor for questions, Shirley. Last but not least, we have Miss Paula Harrington. Paula is a outreach coordinator for the Oxford Houses of North Carolina. She's also on the board of directors of the Freedom House. So using her talents, expertise, and her extensive network, she's assisted hundreds of consumers in Oxford houses across the state. Paula will be discussing the unique challenges that women face in their recovery. The recovery process looks different for every woman, but the majority of women that enter in recovery are going to be between the ages of 20 and 40, of course that varies, and their bodies are especially vulnerable to the effects of drugs. So Paula has chosen to take a closer look at the way that addiction impacts a woman's life, and specifically the ways that providers can tap into the natural supports that consumers have to enhance their strengths.
My name is Paula Harrington, and I'm a woman in long-term recovery, and my sobriety today is April 26, 1998, and I'm truly grateful because I used heroin and crack cocaine for 30 years, and now I've gotten 16 years clean. My journey started. That's what my family says. Yeah. But really, it's a privilege to talk about recovery because this is what I do. I stay clean. I retired from UNC Chapel Hill 2 years ago as an HR facilitator, so we do recover. You know, we get back on track, and that exactly is what recovery is about. It's about the long process of complete cessation where life otherwise had been changed, where we get back into being accountable and productive. So I was really grateful about that. As far as the navigation, I was glad when Alcohol and Drug Council asked me to be a navigator because I have personal experience with seeing how not having health care can impact someone. My dad died from cancer, but he had insurance. But the next lady in the office, her brother had lost his job, and so therefore he had no treatment. And after a lot of advocating the last 6 months before he died, his insurance came through. But guess what? He died in 6 months. So I believe that we have an obligation and a responsibility to reach everyone, to let them know that treatment should be a right that we get, that we need to have affordable care. And so therefore I talk to people, and I know a lot of people don't understand that, but I believe that if we keep at it, that we'll get it. And so I know that it should be something that we depend on. So women in recovery have unique responsibilities, and these are some of the common issues that women face. Psychological issues. What this is the way the body functions for women. Women's bodies metabolize different than men. And so a lot of times when they're using substances, their body is going through different trials. And so therefore it impacts them differently. That's why they have the mood swings and different other issues that go on. And also they're in recovery, it impacts how they feel also. And a lot of times this is why women relapse. It's because their physiological functions are not coping well with them. Then family issues. I had a lot to do with this. CPS got involved in my case. I had my family to help me, which was good. My husband was an addict. So I had all of that, trying to balance a career, family, and my drug uses. And we all know that when you have this disease, what happens first? The drugs. And so it took me a long time. I went to treatment twice, almost lost my job. I was just a mess, and this is because where my disease. So once I finally got clean, I was able to do some of the things that I needed to do to get my family back on track. I went to counseling, parenting classes, outpatient treatment groups, and these are some things that affordable care will help people get. Because most of the time, especially women, if they have gone through these kind of issues, they need that outside help, like seeking safety or trauma or anger management classes, things that will help them get back on track, because we are so desperate at that time and we're so tired. Hormonal issues. This explains why the women, we're women. We don't think like guys. We're up and down, up and down, up and down, up and down. And so therefore, when we throw drugs in the mix, then that makes it even harder to adjust to what's going on in our life. So our hormones are always raging. And one lady told me, and I didn't know this, and this is from being in the field, she said that after a while you'll have those hormone imbalances, and that's why a lot of women start using again and they relapse. Domestic issues. Basically, this is about how you're able to cope with the rest of your family and live within in your house and do the things that you need to do. And most of us, a lot of women have been in abusive relationships. I was in a very abusive, physical and mental. And you know what? I stayed in a long time because while I was using, I felt like that's what I deserved. I had no idea that I did not deserve that. But once I got clean and sober, I was able to address the fact that I didn't deserve that nobody does. And I had the tools so that I could deal with coming out of an abusive relationship so that I could move on with my recovery. It's hard to stay in an abusive relationship and recover at the same time. relationship issues. This is more centered around your children or any issues you might have had in your childhood. I was very blessed that once I got clean and sober, my kids understood that I had a disease. That was very important for me to let everyone know that I had a disease. My family, my parents were very church, religious people, and to them they couldn't understand that concept. But guess what? Today they understand that I had this disease, but I'm recovering from it a day at a time. My children say the most important thing to them on any given day is my recovery. And they are doing well. My daughter just graduated from law school, passed the bar. My son's a minister, and my other daughter is a research engineer. But they say the most important thing to them on any given day is my recovery. A brief history of women and recovery. This is very important, and I want us to pay attention to the fact that the first wave was only about women's rights to vote and legal obstacles to gender equality. The second wave was about sexuality, reproduction, the family, the workplace, and male violence. The third wave was about personal experience, individual diversity, choice, and change. And then it was finally recognized that women share political and economic interests with men in diverse experiences, but they were still portrayed as bad or sad or mad if they used. And I just retired from UNC, but they knew I worked with people in recovery. They didn't necessarily know that I was in recovery, because there still is that stigma. And so that's why it's so important that faces and voices of recovery is around to put a name to us so that we can see that it's a lifelong process and that this is something that can impact anyone, but we have the right to recover. Then women often share some of the same common experiences, sexual work. That's like being a stripper. A lot of women, that's the only job they know. That's the only thing they do. So when they try to get clean, they have to try to figure out, what am I going to do now? How am I going to take care of myself when I'm not educated, I don't even have a GED, and this is what my life has become. And now we're seeing that even younger girls are getting into it earlier. Sexual relationships. This really means sleeping around, pretty much. A lot of multiple partners. And a lot of this goes hand in hand with addiction. Sad as it is, it's the truth, it's the way it is. And it's not just the females, it's the males as well. But a lot of time, promiscuity goes along with addiction. Pregnancy and mothering. A lot of people have children because of their drug use and because of their being promiscuous. Abuse. Being abused, staying in abuse, being abused. The drugs make you do all these things. Then there are barriers that women face accessing services. A lot of it is because they're afraid to tell someone. They don't want anyone to know that I'm going through this. I have problems, the anonymity kind of thing going on. They don't want anyone to know. They're afraid that someone would look down at them if they know that they're going through certain trials. So there's a need for specialized services for women, and these are some things that women have to tap into. A lot of girls that I see now in the Oxford houses, they haven't finished high school, and I was like, when did that stop? We always just go to high school, but now people are dropping out. They are having kids, no parenting skills, so they need classes, parenting classes. A lot of them have been traumatized, so they need seeking safety. A lot of things that if they have treatment, they will probably be able to get, that they probably would not be able to get or not even think about because they don't have the knowledge to know that that kind of help is available. So their experiences for women are unique from men because most men typically have drug-related assaults, car accidents, or fighting. So then what does that leave the women? That means that most women have poor health and early recovery because they usually are self-harming, suicidal thoughts, actual suicide attempts, and sexual abuse. And I've been running into a lot of girls where they're cutting themselves. And it's like they don't want to feel that pain anymore. They're so tired. They want to get clean, but they don't know how. They're in abusive relationships. And so the best thing they can think of is I must inflict some pain on myself. And that caused them to have the suicidal thoughts, the actual suicide attempts. Then the bodily changes. There's a high level of anxiety and increased weight loss and change in their menstrual cycle. This eating disorders is really big. This is what I've noticed. And have any of y'all noticed how much people are having these eating disorders? And it's hard to tap into the recovery if they're not addressing their eating disorders. And it's very frustrating to see someone that's struggling very much with their this eating disorder, but there's nothing but inpatient treatment. And then inpatient treatment they can't afford. So hopefully if they get affordable care, that will be able to address some of these issues, because people aren't able to address the eating disorder unless they have to address both of them at the same time, pretty much. Okay. Recovery capital. Now, what is recovery capital? Recovery capital is the quantity and quality of internal and external resources that one can bear on the initiation and maintenance of recovery. This is pretty big, because what this is talking about all the things that you will need to do for the rest of your life. Because when you're in recovery, it's a lifelong process. It doesn't stop. Like, I had 16 years, I still have a sponsor, I still go to meetings, I still work steps, I still have to take care of myself. The social part of recovery capital is the informal support, the non-using friends. This is real significant when we talk about the Narcotics Anonymous or AA programs and any other self-help groups that where you are able to network with other people that are trying to do the same thing you do. That's why the Oxford House is real important to a lot of people's recovery, because it's a safe place where everyone there is trying to stay clean and sober, because if you don't stay clean and sober, we're going to put you out. Okay? So physical, the material support such as housing. Now, a lot of times you might have to depend on your parent or your family, but the important thing that you have to think about is a safe place. Now, we know drugs are everywhere, but you have to be in an environment where it's conducive to you maintaining your sobriety. But that's important. It's very important. Human, the budgeting skills and high hopes and aspirations. Lately, I've been running into a lot of people that haven't even finished high school. So they have all these things they need to do. And then we were talking about the dental, where they can't go look for a job because they are not appropriate for it. I was blessed that I went to college, but I still used, So some people are very unemployable, so they have a few more things that they have to work on. So what we have to do is help them focus on taking tiny steps, not trying to do everything at once, and just to focus on their recovery and the things they need to do so they'll be able to have employment opportunities. But we want them to know that they still have dreams and they do recover. Culture, this is the self-care part. This is real big, because this is about you taking care of yourself. This is about those of us in recovery, and this is what I do with the ladies. A lot of them look at me and say, I'll never forget one of the girls at the house. One of the houses, she went to an NA meeting. She saw me there. She said, I saw Miss Paula at a meeting. I said, yeah, Miss Paula's in recovery too. Miss Paula has to do this thing a day at a time as well. And so we want them to know that even though I might not look like you, I still have the same disease. And there's some, the spiritual growth is important with self-care. The closer you get to your higher power, and the better that your walk will be. Now, I must tell you, until recently, I was a big, only NAAA, no drugs. But I've learned through the last year or so that we have to meet people where they are, and that sometimes we have to take baby steps, and that just because this person does not recover like I do, that we need to help nurture them. That was big for me. I came from the old school. I was not trying to hear that, but I understand now that some medication is necessary, as long as the focus is still on them recovering and learning how to try to be drug-free. But there are some other things about the cultural, and that is some developmental consciousness. That means you just grow up. Then there's the medical health, where a lot of times your health is in jeopardy, so therefore you have to do something. Then there's religious and spiritual growth, and that's where the faith-based community is coming in. There's a lot of programs like Celebrate Recovery. Like they just did a cookout for my women and children houses in Chapel Hill and Carborough this past weekend, and it was just so inspirational, but it also helped the ladies. And then political. Some people still think that it's just a form of genocide. But what we know is that self-care means that you're looking at all it takes to take care of yourself and your sobriety. Health. What have you seen in your practice experience to include in this category? Has anybody seen anything that you can include in this category? Well, one of the things I've noticed is that a lot of times once a person finds out that they have certain diseases, they are so afraid. They don't want to deal with it anymore. But what we have to realize is that they need the treatment, and therefore there's a lot of clinical trials there. One guy I knew, he said by the time he got here, he didn't have HIV, he already had AIDS. And guess what? He is 25 years clean. So we have to be able to let people understand that there's a responsibility to learn about whatever disease they have and get the appropriate treatment. And so once we get affordable care, then they're able to do that, because then they're able to look at themselves and get the counseling and whatever they need to make sure that they're able to get the treatment that they need. So recovery capital to me is a continuum of growth for a full life process, and the health insurance can help facilitate that. Thank you.
I'll just introduce myself. I'm Sarah Arthur, and I'm a care coordinator at Coastal Care. So I was just wondering from you guys what feedback you've gotten from consumers on the deductibles, and if they see kind of the benefits of the free preventative care versus the high deductible that some of the plans offer.
Well, I've actually got a few people that are they're just so happy to have it because they've been suffering a long time. They haven't had any insurance. I had one girl that she had 17 years clean. She lost her job about 2 or 3 years ago, but she hasn't used. But the area she was in, she's probably eventually going to have to not stay in that field because it's not working for her. But because she was able to get health insurance, and I think part of the stress and everything was causing her headaches and stuff, but then she was able to go and to see about it. So even though it's she has to pay something, still she feels a little bit better than she did a couple years ago when she had nothing. So I think a lot of them are just, really glad to have it, and that they're trying to figure out, well, what can I do just to keep it,
Most of the clients that I've worked with has either gotten the 0 deductible or the lower 500 deductible, but I have had a couple that's chosen the 1,500, and there again, they just have to be more realistic as to what they can afford. Most of the clients that I've worked with are in that early recovery phase, and like Paula said, they're just happy to have something. And one gentleman in particular that I worked with, we spent about 3.5 hours one night trying to pick him a plan, and because he did have a little bit of money that he could have pulled from, but I think it's just a personal choice, and then also has to take into consideration what kind of care they're wanting, and to pull up under that details tag and look at the physicians and the exclusions and the inclusions of that particular plan.
One kind of interesting note that I learned about in Virginia is taking something like SBIRT, and they're trying to integrate SBIRT into what they would consider preventative care services so that you circumvent the whole deductible issue and where you have low cost or no cost intervention. So that's something that's on the horizon, and it's something that's in progress. So.
All right, and before we open up for a bigger discussion, we have one more person that we're going to ask to come up. So Pam Stalls is the executive director here at the Wilmington Treatment Center. She is a licensed clinician with over 20 years of experience in both for-profit and nonprofit. And so I'm just going to ask her to come up here and just kind of give her perspective from the facilities perspective on how the ACA has impacted the clients here. And then after that, we'll open it up and you can ask questions to any of the panelists.
Good afternoon. I am going to speak specifically towards the substance abuse impact from the Affordable Care Act. I know that in working in the state system as we were moving forward with mental health reform and a lot of the changes in the state of North Carolina, we always had concerns about where our patients were going to receive services. I've had the privilege of being here at Wilmington Treatment Center for the last 4.5 years, 4.5 of them almost literally as the director of counseling and now as the executive director. We do and we have seen an increased impact here from the Affordable Care Act, particularly initially when it was implemented and it allowed parents to keep their 18 to 26-year-olds on insurance up until the age of 26, where before they had to be in college in order to be able to access that care or that coverage. So what we have found and what all of the commercial providers have found is now we have a whole new population to treat. We very much, prior to the Affordable Care Act, served basically 30 and older, peppered in with a few younger people who were in college, a few meaning out of 100 and some patients on the unit, we might have 15 that were under the age of 25. In the last 5 years, I would say of 124 patients, 50% are 25 and under. So that's been somewhat of a challenge for the commercial service providers, but it's also a privilege because we're now having the opportunity to intervene at a much earlier stage for this, this population. And so a lot of our services have changed. We now, and this is across CRC Healthcare, which is our parent company, has 140 some sites. And so those of us that are residential providers, we're looking at restructuring, and some of us have already done it, others are on the way, to particularly target that 18 to 25-year-old population with more engaging services, with counselors who understand that age group. Where before we would very much focus on hiring staff that understood a 30 to 60 or 80-year-old patient, now we have to look at counselors that really can dig into and engage with this younger population. And it's been really, really a lot of fun because we have the opportunity to see them get well. And, you know, I go to the beach and I'm walking around the loop at Wrightsville Beach and a truckload of kids goes by and they're all screaming, Miss Pam, you know, because they are leaving the halfway house and going to the beach for that day. We certainly have seen, I am sure, the older population come in who've elected the Affordable Care Act, but we don't know who that is because we don't have any way of discerning what insurance somebody's using or not. Somebody comes into treatment here, they're a patient that needs services. So there's no differentiation at all. The major impact that we've seen is with the 18 to 26-year-olds, which, while challenging, is also equally rewarding. And so, you know, part of the reason that I wanted to share that is I know in working in the state system, there's a lot of fear about what commercial-based programs do, and do we do a good job of treating patients? You know, you talked about women's services. We contract with Local Rape Crisis from Coastal Horizon. My staff are trained in seeking safety. We contract with EMDR providers. My staff are trained in CPT for treatment of sexual trauma, PTSD, and combat-related trauma for our veterans in active duty. We look at what patients are presenting in front of us, and we work very hard to make sure that we bring into this facility what they need. Our first priority is to treat substance abuse. We certainly never deny any of the secondary issues. We see a lot of patients addicted to prescription drugs. Our medical team does an amazing job of working with patients who come in with chronic pain and identifying alternative pain management strategies, because our medical director is committed, as an ASAM certified medical director, providing people quality of life abstinence-based quality of life. So, you know, part of my hope is that as people move through the Affordable Care Act and as people are looking, because where they're going to receive services is going to change. And as that changes, I hope that we have more and more opportunity to come together as those of you that are transitioning your patients into the commercial environment with those of us that have been doing this for 30 years come October. Because we all have the same love and passion for addicts and alcoholics, and we have all committed our lives, 20 years, gray hair to show it, to helping addicts and alcoholics get well and have a happy, healthy recovery life. And so I believe as we move forward with this that we can be partners. And that's my passion, is that we can all be partners in this so that we can help anybody out there that needs any type of service to be able to access what it is that they need. We're all in this together because it's all about the suffering addict and alcoholic not having to suffer anymore.
I'm so glad that you mentioned that, and I just wanted to tell you about a new initiative we're trying to do at Oxford House. We're trying to get a Oxford House for students. I started using when I was in college. And so therefore now we've been partnering with UNC Chapel Hill and trying to get to some of the other ones. And there's a lot of interest that when a person gets in trouble in college and they need to come back to school, you can't put them back in the dorm. So you need to kind of put them somewhere else. So that's one of the biggest initiatives, because like you're saying, they're coming in early, which I'm glad. I wish I had a clue when I was 20. You know, I wish someone had told me, you know. So now it's a great opportunity, and I agree with you on that.
Thank you, Pam, for sharing with us.